Good morning, everyone. My name is Shweta, and my team members are Damanpreet Kaur, Priya, Priyanka Datta, and Ramsha Arif. And our group name is The Five Sparks. And today we will present our capstone part 2, which is on fall prevention in older adults. Okay, so in this slide, we will discuss about why this topic. Falls are a major health concern for seniors. They are the leading cause of injury-related hospitalizations in older adults. Then high incidence rate. About 1 in 3 adults over 65 experiences a fall annually as per the Canadian Patient Safety Institute 2021. Then serious consequences. Falls result in prolonged hospital stays, increased healthcare cost, and a decline in the quality of life of seniors. Then, why is this a Canadian healthcare issue? Aging population, Canada has an increasing number of elderly individuals, creating a great need for all fall prevention strategies. Healthcare system burden. Falls lead to more hospital admissions, straining resources, and affecting patient care. National priority. Fall prevention aligns with national patient safety goals as per recognized by some organizations like Registered Nurses Association of Ontario 2017.
So in this slide, I'm going to discuss about quality improvement solutions. So I have used multifactorial approach that addresses both environmental and patient specific risk factors. First one is fall risk assessment. So it is one of the most effective strategies performing a fall risk assessment upon admission. When I worked into the hospital, I have used Morse fall scales, which helps me to identify patients who are at high risk of fall and allows me to implement early interventions in all those patients. Second one is environmental modification. So right now I'm working as personal support worker in long-term care center, and I have seen that they are using various strategies, which includes installing grab bars into the washrooms, using non-slip flooring. And then they are also using ensuring that they are using adequate lighting, and lastly keeping the walkways clear of obstacles. Then medication review. Majority of my clients are on antihypertensive medications. Along with that, they are also on sedatives and diuretics. So what happens? These medications increases the risk because they causes dizziness and low blood pressure. So regular medication review is important by the pharmacists and nurses, and this can help to identify and adjusting their high risk medications. Then coming on to strength and mobility training. So encouraging patients to engage in mobility exercises, for example, balance training and strength building activities. Then physiotherapist plays a huge role in tailoring these exercises to according patient's need. Then coming on to assistive devices and technology. So in LTCs, I have seen majority of the patients are dementia and Alzheimer's. They are suffering from it. So using mobility aids like walkers, hip protectors, and canes. What happens like in the night, these dementia and Alzheimer's patients usually get up and they wander around. So I have seen in Canada only that there are advanced fall detection technology, which includes wearable sensors and bed alarms. This can alert nurses when a high risk patient attempts to get up from the bed unassisted. This is all from this slide. In the next slide, I would discuss about evaluating the outcomes. Thank you. Now, in this slide, I would discuss about evaluating outcomes, or how will we measure success. To ensure that quality improvement initiative is effective, we use both qualitative and quantitative data to measure outcomes. According to Health Quality Ontario, which is called HQO, approximately 14.2% of long-term care residents in Ontario experience a fall within a period of 30 days. So the goal is to reduce this percentage to 7% over the next year through evidence-based fall prevention strategies. To track progress, we will implement a standardized assessment such as Resident Assessment Instrument, which is called Minimum Data Set, or RAIMDH, which is recommended by HQO. This tool will help us consistently document and monitor fall risk incidents. Additionally, we will compare pre and post intervention data against provincial benchmarks to determine the effectiveness of the strategies used. So, beyond numerical data, we will also gather patient and staff feedback through surveys and interviews using HQO's fall prevention self learning packages. The qualitative data will help us to understand the practical impact of our interventions on patient safety and care delivery. Finally, we will integrate these evaluations into a continuous learning improvement plan, which is also called QIP, aligned with HQO guidelines. This plan will be reviewed and updated regularly to ensure sustained progress and adaptability to emerging best practices in fall prevention. So that's all from my side. Now my teammates would discuss further slides. Thank you.
Hello everyone, I am Priyanka and here I am going to discuss about common challenges in fall prevention and solutions. First of all, falls among seniors are a serious issue and healthcare providers face a range of challenges in preventing them. Resistance to change, limited funding for safety equipment and training, incontinence adherence to protocols and communication gap between the team can all create barriers to effect fall prevention. But there are good news. We can tackle these challenges ahead on by integrating technology like fall detection system, educating patients and families, improving room environment with safety features, and conducting regular risk assessment. We can create a safe environment for everyone. Let's work together to reduce falls and enhance patient safety because every step counts. Thank you. Now I am going to discuss about impact on staff, leadership and patients. First is impact on staff. Fall prevention adds to staff workload and stress, but when it effective, it reduces incidents leading to improved job satisfaction and less burnout. Second is impact on leadership. Leaders play a crucial role in security resources, enforcing safety standards and creating a culture that support both staff and patient safety. Third one is the impact on patients. Fall prevention reduce injuries, enhance independence, and boost confidence, improving patients' emotional well-being and overall quality of life. Thank you.
So this slide will talk about the sustainability plan. To ensure the long-term success of fall prevention, we need a structured and sustainable approach. This 5-year plan focuses on four essential areas. First one is policy integration, make fall prevention a mandatory practice guideline. And second one is ongoing staff training. Through this, refresher courses and competency check keep healthcare professionals up to date. And third one is patient and family education. It empowers individual with knowledge through interactive workshops, promoting shared responsibility in fall prevention. Finally, continuous monitoring through annual evaluation. It allows us to assess effectiveness and make necessary improvement. By embedding these four strategies into our healthcare system, we create a proactive, sustainable approach to fall prevention. Ultimately, it enhances patient safety and outcomes. So, this slide will talk about the leadership style and nursing theory. Effective fall prevention requires strong leadership and a solid theoretical foundation. We apply transformational leadership, which encourages innovation, staff involvement, and a culture of accountability. By empowering healthcare teams, we create a patient centered environment where fall prevention is a major priority. So, in the nursing theory, we mainly focus on human system model that guides our approach by addressing multiple risk factors like physical, environmental, and psychological that contributes to fall. The holistic perspective allows us to develop individualized fall prevention strategies tailored to each patient's unique needs. By combining leadership and theory, we build a comprehensive and adaptive framework for preventing fall and improving patient-centered care.
I'm going to discuss about the required resources, which are the financial for buying the new equipments and new technology, human resources for uh, making the leaders to motivate the staff, training like the ongoing workshops and ongoing learning, technology like EHR and other things which can enhance the patient improvement. According to Health Quality Ontario, these are the vital components of any successful quality improvement plan. In the conclusion, our project addresses a significant issue in the Canadian healthcare, and we offered a practical quality improvement solutions. We proposed measurable interventions, evaluations, and the plans for the sustainability. Nurse leaderships play important roles in ensuring these changes are ethical, evidence based, and patient centered. With the right resources and commitment team, we can make a meaningful and lasting impact on the healthcare quality and the patient safety.